be comparing two major Today I'll be comparing two major chronic respiratory diseases, asthma and COPD. Both conditions affect the same organ system, which happen to be the lungs. Although they behave very differently in terms of airflow, inflammation, and long-term progression. In clinical pathology, it's essential to understand these differences, especially when assessing patient symptoms and the treatment our patients need. The respiratory system is a fascinating group of organs that allow us to breathe. Its main job is to bring oxygen into our bodies and remove carbon dioxide. The respiratory system includes the nose, the mouth, the throat, which is the pharynx, the voice box, which is the larynx, the windpipe, which is known as the trachea, the lungs, the airways inside of our lungs, which are the bronchi and bronchioles, and the tiny air sacs where gas exchange occurs, which is in the alveoli. Humans breathe in oxygen, and then our lungs deliver it to the rest of our body, and we breathe out carbon dioxide. So our bodies can hold a balance that gives us life. In this report, I will compare and contrast two respiratory diseases, asthma and COPD, which is a chronic obstructive disease. I will examine how these two common respiratory diseases share key features but greatly differ in their causes, progression, and treatment. Asthma makes breathing difficult because it actually narrows the airways, causing them to swell and in some cases produce extra mucus inside of the lungs. Signs of asthma include wheezing when one breathes out, along with a shortness of breath, a tightness or pain in the chest, trouble sleeping, and coughing or wheezing attacks, which can also worsen if accompanied by a virus. Asthma is sometimes confused with another separate respiratory condition called COPD, a chronic obstructive pulmonary disease. COPD is a long-term disease, making it difficult to breathe due to damaged, inflamed, and permanently narrowed airways and air sacs. Both conditions affect airflow obstruction, coughing, and shortness of breath. But unlike COPD, asthma is typically reversible and inflammation triggered, whereas COPD is more likely caused by long-term lung damage. Asthma can also be confused with other respiratory infections, vocal cord dysfunction, or pulmonary edema. For some asthmatic individuals, the disease can progress and worsen over time. It truly depends on the person, the level at which their inflammation is controlled, along with several other lifestyle and environmental factors. Results can be anywhere from symptoms stabilizing over long periods of time, some outgrowing asthma entirely, to others experiencing irreversible airway changes that decline lung function. The airways basically remodel themselves from repeated inflammation. As the body tries to repair the damage, it then weakens in the process. What happens is the smooth layer of muscle around the airways thickens, resulting in scar-like tissue building up beneath the airway lining. Mucus-producing cells then multiply, and the airway wall has newly formed blood vessels. As a result, the airways become narrower, stiffer, and more reactive. With regards to treating asthma, there are two most common medications prescribed, known as controllers and relievers. Controllers treat asthma long-term by acting on behalf of airway inflammation, and the relievers arrive to the rescue for short-term relief of symptoms. Controllers are meant to be taken every day and over time. They can cause fewer symptoms, whereas relievers are short-acting, providing temporary relief, and should be taken no more than twice a week. A solid rule of thumb is that if the asthma symptoms are not controlled well enough with the controller medication, then it will result in the need to take the reliever more frequently. Individuals with asthma should consult their physician to find a suitable medication dose. Other signs that an asthmatic individual is not properly controlling their asthma is if they're waking up in the middle of the night, coughing, wheezing, they're missing school or work, finding it difficult to participate in everyday activities, and requiring emergency care just to breathe properly. When patients with asthma experience severe symptoms that don't improve with medication, they may require clinical treatment. A severe asthma attack can become a medical emergency quickly, which is why individuals must understand the difference between daily maintenance care and emergency care. This is an important part of asthma management. For an asthma diagnosis, a physician may run allergy blood or skin tests to determine if an allergy is the trigger for the asthma symptoms. A provider can look at a patient's blood count to consider eosinophil and immunoglobulin E levels. Furthermore, a physician can perform a spirometry test to measure the airflow in the lungs, test x-rays or CT scans to look for causes or symptoms, and or perform a peak flow meter, which measures any restriction in the airways occurring during activities. Chest x-rays can show if hyperinflation is occurring in the lungs, which means that the air has become trapped, and this gives off the appearance of larger lungs. Bronchial wall thickening can also be shown on an x-ray, which is due to irritants entering into the airways, resulting in the passageways, the bronchi, becoming inflamed or swollen. CT scans are similar in that they can provide detailed images of the lungs, but they can also show changes regarding the bronchioles, which are a deeper look at the bronchi because doctors can see the structure of the branches that expand from the bronchi. Asthma affects both children and adults, but it is a chronic disease most common among children. The disease has affected an estimated 262 million people in 2019 and has caused 455,000 deaths. For those experiencing asthma who live in the Ottawa area, there are a few different respirologists who specialize in asthma, such as the Ottawa Hospital, CHEO Respirology Clinic, Dr. Usu's Respiratory Clinic, and the Carling Respiratory Services. The Ottawa Hospital offers a directory of respirologists, but referrals are required for consultations. CHEO specializes in complex breathing problems, including asthma, and accepts referrals, as does the Carling Respiratory Services. But Dr. Usu's clinic manages chronic respiratory conditions like asthma, and appointments can be made through their clinic. According to new data from Statistics Canada, about 36% of Ontario residents who sought an assessment from a medical specialist waited more than 3 months. There are multiple support groups in or around the Ottawa area for those who experience asthma, such as the Ontario Lung Association, Asthma Circle of Care, Asthma Canada, Chaplain Healthline, and the Ottawa Public Health. The Ontario Lung Association provides free support options, resources, and support for quitting smoking. The Asthma Circle of Care offers a helpline for asthma-related questions. Asthma Canada has a free service where you can speak with a certified respiratory educator. Chaplain Healthline includes downloadable resources for asthmatic and COPD patients. The Ottawa Public Health helps people manage their condition by offering support on what to do during an asthma attack, has preventative strategies, and advice for those who smoke. With support like this, individuals can better manage their condition. COPD is very similar to asthma, as symptoms include trouble catching your breath, wheezing or whistling sounds when you're breathing, chest tightness or heaviness, an ongoing cough with clear, white, yellow, or greenish mucus, and a general feeling of low energy, fatigue, and tiredness. Other symptoms may include swelling in the ankles and or feet if the COPD is advanced. Those living in the Ottawa area with this disease can access the same respiratory specialist as asthma patients. Available clinics include the Ottawa Hospital, Carling Respiratory Services, and CHEO, although referrals are required and wait times can exceed 3 months. People with COPD can access support groups to provide them with the education about the disease, emotional support, and a sense of community, which is meant for both the patient and the caregivers. In-person support groups for COPD in the Ottawa area include the Better Breathers Club, which is also known as the American Lung Association, and the Hospital and Pulmonary Rehabilitation Center support groups. These types of support groups can help patients with COPD receive support and knowledge. Some online support groups include COPD 360 Social, which is the COPD Foundation, and the Mayo Clinic Connect. Within these groups, patients can share their experience and ask questions. There are also resources for caregivers, which are offered through many COPD support networks that offer guidance and assistance to those with COPD and their loved ones. Some of the programs include caregiver sessions as part of the broader COPD support network. Since COPD is like other lung conditions, it can be difficult to diagnose until the disease has advanced. A healthcare professional will review the patient's family and medical history, as well as any irritant exposure to the lungs. Cigarette smoke is a major irritant prone to cause this disease. A physician may perform a pulmonary function test, lab test, and imaging to assess lung health. They will perform a spirometry test to measure how much airflow is moving through the lungs, being held in the lungs, and whether it's limited or not. A lung volume test may be done to measure how much air the lungs can hold at different times. A lung diffusion test can determine how well the body moves oxygen and carbon dioxide between the lungs and the blood. A pulse oximetry test may be done, where they place a small device on the patient's fingers to measure the oxygen levels in the blood. In certain cases, an exercise test may be conducted to monitor heart and lung function during exercise. COPD affects the lungs by interfering with the body's natural exchange of oxygen and carbon dioxide. When healthy oxygen from the air passes through the alveoli into the blood vessels, while carbon dioxide moves into the alveoli and is then exhaled. While the alveoli stretches naturally and with each breath it recoils, with chronic obstructive pulmonary disease, the alveoli can become weakened and damaged over time. Conditions like emphysema and chronic bronchitis cause the alveoli and airways to lose their natural functioning abilities, making it harder for air to move in and out. In emphysema, the alveoli have a much smaller area to exchange oxygen and carbon dioxide. Furthermore, the older air gets trapped, causing less oxygen to come in. With chronic bronchitis, the bronchial tubes become inflamed and narrowed, and extra mucus further blocks the tubes. This causes an ongoing cough as the lungs try to clear the mucus from the airways. Chronic obstructive pulmonary disease is confused with other diseases that share the same or similar symptoms, such as asthma, heart failure, lung cancer, pneumonia, and bronchiectasis. Asthma is also an obstructive airway disease that is caused by exposure to triggers, causing wheezing, chest tightness, and shortness of breath, making it difficult to distinguish from COPD. Heart failure can create a feeling of shortness of breath and lead to feeling weak. Lung cancer, pneumonia, and bronchiectasis can all make you feel short of breath, causing coughing and overall weakness as well. These symptoms can be misinterpreted due to the similarities that they carry. As COPD is a progressive disease, it can worsen over time, causing what were initially mild symptoms to strengthen, causing a more persistent cough, excessive mucus-producing cough, difficulty performing physical activities, and further causing one to be unable to work, confusion or memory loss, frequent visits to the hospital, and developing depression, anxiety, or other mental health issues. Currently, there isn't a cure for COPD. Treatment focuses on managing symptoms, slowing down the disease's progression, and improving quality of life. Treatment plans consist of making lifestyle changes, such as limiting tobacco use or using substitutes, along with reducing exposure to dust, chemicals, or other pollutants. When a person's COPD is characterized by worsening symptoms, they may need to take medication called bronchodilators, which relax the airways. Other plans may consist of vaccinations, such as flu shots, to reduce the risk of infections that could cause serious complications. They also may offer pulmonary rehabilitation, which can improve lung function through exercise programs and counseling. Oxygen therapy is also an option, which involves breathing from an oxygen tank at certain times of the day. In most severe cases, surgery, such as a lung transplant, could be performed. The type of treatment does vary from person to person, depending on several factors, such as the severity of the disease and the person's overall health. Roughly 480 million people are affected by COPD worldwide, and about 10.6% of adults aged 40 and older carry some aspect of the disease. It is one of the most common chronic diseases we have on the planet, and it comes in fourth as the leading cause of death around the globe, being responsible for 3.5 million deaths in 2021. It is estimated that about 70% of COPD cases go undiagnosed, likely making the scale truly larger. Since chronic obstructive pulmonary disease advances over time, many people find it becomes more difficult to live their everyday lives as it moves forward. They may be able to manage their symptoms in the beginning stages, but as the disease advances, breathing becomes more and more difficult, especially during physical activity, and flare-ups can become more frequent. The factors which affect COPD are one's age, consistency of smoking, the disease's severity, and how well they follow their treatment plan. Many people can continue to live meaningful lives if they are consistent with their care and avoid triggers. In conclusion, asthma and COPD share very distinct, similar symptoms, but differ greatly in their causes, progression, and long-term outcomes. Asthma is typically triggered by inflammation and able to be controlled or over time outgrown, whereas COPD progresses over time, causing long-term lung damage that only worsens with time. Both COPD and asthma require a proper diagnosis, along with monitoring and a suitable individualized treatment plan to help manage their symptoms and improve their quality of life. Individuals with COPD or asthma can understand their condition better and take necessary steps to maintain their respiratory health through accessing specialized care, community support, and appropriate treatment plans.